Hi, my name is Alexa Hetzel. I am a physician assistant at Schweiger Dermatology in East Windsor, New Jersey. I carry my doctorate degree and I am the director of clinical trials here in our office. So very grateful to be able to be here with you today and to be discussing what do we do with these patients with vitiligo, right? We walk into the room and you can see it. If we're talking about facial vitiligo, you can see that depigmentation across all skin tones. It might be a little bit more masked with somebody who's a lighter Fitzpatrick, like myself, versus somebody who comes in with a darker Fitzpatrick. But this can be so debilitating for our patients, not physically. We know our vitiligo is not dangerous for our health, but it can be dangerous for our mental health, which is usually why patients walk in the door. They want our help because this isn't something that they can hide. So what were our options before? We didn't have a lot of great options until we had Opzelura, something that is non-steroidal, that is very specific and very targeted as a topical JAK inhibitor that is focusing on the assault that is happening to our melanocytes and allowing this repigmentation to occur. Ultimately, we know within clinical trials, data is cut and dry, right? I run a research department. We look at things quite honestly like vitiligo, black and white. And so when we're looking at repigmentation, when we looked at the results for patients with the F-VASI of 75, not only at week 24, but all the way out to week 52, we know vitiligo can be a very fickle and tedious disease to treat. That when we're looking at week 52, 51% of patients achieved a 75% repigmentation of their facial skin. That is a very specific mark, right? So VASI of 75 and then a VASI of 90, there's a range there. So if patients were an F-VASI of 89, they are considered 75% repigmentation. And that's just data when we look at that cut and dry, black and white. So that level of improvement really allows patients to enjoy the things that they might have been avoiding before and allow the makeup that wasn't covering those areas of depigmentation as well, finally give them some relief to cover those depigmented areas that maybe persist. But then when we look, of course, because we're dermatology providers, right? We are overachievers. We just don't want 75% improvement. We want 90% improvement, right? And so when we look at the data, 1 out of 3 patients at week 52 had 90% improvement and repigmentation of their vitiligo with twice daily Opzelura use. That is such a significant marker because 90% improvement is life-changing, even more so than that 75%. And when we look at the photos or we look at the patients when they walk in the room, that's something that could be very minimally detectable when we see these patients. Maybe they have a little spot in their eyebrow that's left over, a little spot by their nose, something that they can much more easily manage and control and just feel more empowered. Ultimately, because we do know 100% sometimes is more difficult, or this can be a slow process for patients. We might be able to see clearer skin when we look out to 2 years. But this also really reinforces our patients to stay consistent. It is very easy to do something for 2 weeks, right? We are all perfect at doing things twice daily, 3 times a day, whatever it ends up being for 2 weeks. And then after that, does it become habit? So we want to really reinforce that our patients continue the Opzelura twice daily dosing for long term. So when we start to see this repigmentation come back for patients, I always hype up my patients like, look at how great you're doing. Oh my goodness, this is working. Let's keep going. I take my own photos when I see patients from baseline and when I have them come back for checkpoints, just to really reinforce that message and not only to be their provider, but to be their cheerleader because it's very easy to get down on yourself and be like, but this is still left. Okay, well, let's remember where we came from. Look at how much we've improved, how much we've continued to grow and change and improve the vitiligo. So it's very easy for us to focus on that negative. So let's really focus on that positive and be our patient's cheerleader. Show them their photos, really encourage them to continue that twice daily dosing because that's when we see the most efficacy and the most repigmentation. And let's get them on their journey to clearer, repigmented, uniform skin. So I also talk to patients about the repigmentation process ultimately, because it just doesn't go from white to repigmented. It goes from white to those little splotches, almost like you were painting and you got paint on your skin. Remind patients that that is positive. That is when we're seeing these repigmented areas, and those will start to collect and coalesce together and fill in whatever area we're talking about. If it's a spot above your eyebrow, a spot on your cheek, maybe a spot on your neck, give it some time. When we see these islands, that is exactly what we want to see. We're not just going to see everything go from one shade to another. We're going to start to see those small little pockets of change over time.